So, hello and welcome to the latest Covid-19 media briefing. It's Friday the 12th of November. This is a joint briefing by Nottingham City Council, Nottinghamshire County Council and the NHS to give the media an opportunity to get the latest updates on our response to the Covid-19 pandemic. Our panel today is Lucy Hubber, Director of Public Health in Nottingham, Jonathan Gribbin, Director of Public Health in Nottinghamshire, and Amanda Sullivan, Accountable Officer for the NHS in Nottingham and Nottinghamshire. I know you all know this, but just for the purpose of the recording, the usual format applies. Our panellists will give an opening update on Covid-19. We'll then open the floor to questions. As always, it's one question and one follow-up question. And please remain on mute with the cameras off until it's your turn to ask a question. And also, for the purpose of the recording, when you do ask a question, if you could identify yourself and which media you represent, that would be really helpful. So if everyone's happy, I'll hand over first to Amanda in the NHS.
Thank you very much and morning. So the NHS remains under significant pressure and we are unfortunately still seeing high levels of people who need to go into hospital with coronavirus. And this has risen slightly over the last week or so. So we had 186 people in our hospitals on the 9th of November compared to 160 people the week before. So you can see just a slight rise. And this is almost 2/3 of the highest levels that we had in wave 1. And in addition, we have more people coming forward with health problems that were stored up through the waves of the pandemic in earlier times, and there are also winter viruses in circulation that are adding to the pressures. So as we go into the winter months, it's more important than ever that you boost your immunity to flu and coronavirus if you are eligible for a jab. So for coronavirus booster jabs, more and more people are becoming eligible now, and our booster programme is progressing really well. We have dozens of local sites and larger sites also at the Forest Rec, Kingsmill Hospital and Mansfield Vaccination Centre. You can book these via 119 or the national booking website 30 days ahead now of being eligible, and you'll see a range of sites that come up that show you how far away they are from where you live, and you could also receive an invite from your GP as well. So all of those options are available to you. As you come online for your 6 months past your second dose, do please book that and get yourself protected ahead of winter. So now we have around 82% of our over 18s who've received 2 doses, and we still have good numbers of people coming forward for first and second jabs as well. So you can walk into our main vaccination sites and still get your jab ahead of winter, or book an appointment via 119 or the national website. So do still come forward for your first or second jabs if you are eligible. And then also around 1/3 now of our 12 to 15-year-olds have been vaccinated, so that's good news. And 59% of our 16 to 18-year-olds have been vaccinated. So it's great that those young people are coming forward and continuing to come forward as well. We're still visiting schools. That is the primary way for 12 to 15-year-olds to get your vaccines. But if you do miss that opportunity, you can use the national booking service to book into one of our special sessions for young people. So that was my main messages. Thank you very much, Steve.
Thank you, Amanda. We'll hand over next to Lucy Hubber from Nottingham City.
Hi, and good morning, everyone. The situation in Nottingham is remaining relatively stable. So we have been bobbing along at around the mid 200s. Last week we saw an increase up into the low 300s, and this week we're back down again into about 240 per 100,000. Now that's a really great picture in terms of not seeing an increase, a sustained increase, but 240 is still a really high case rate. The population in Nottingham have been brilliant and continue to be brilliant about getting tested when they've got symptoms. And that's helping us keep those numbers as low as they are. So I wanted to say thank you to the population, but to remind them, still important to get tested, because as we begin to spend more time seeing people, and particularly as we begin to move indoors, getting tested using the rapid tests on a regular basis, or getting one of the special PCR tests if you've got symptoms, no matter how mild, will help protect yourself and protect those around you. I think the other thing to say is that there's a number of other actions people can take as we begin to move into this winter period. Lots of great things in the run up to Christmas, and we're seeing the opening of Winter Wonderland next week in the city. When you're walking around shops, or when you're meeting others, try to remember to wear a face covering in indoor settings or crowded outdoor settings. Masks really do work in terms of protecting other people, and there's something very simple that we can all do that make a difference. And obviously, as we've heard from Amanda earlier, it's never too late to have your vaccine. Really important to have the booster dose if you're eligible. But if you haven't yet had the dose and you've been waiting to see if it might be safe for you to have, we've now been offering the vaccine for nearly a year. And what we're finding is not only is the vaccine really safe and much, much safer than risking having COVID, but also it's really effective. So despite the case rates being in the 240s, actually the pressure on the hospital has been very different from how it was at the same point last year. So get vaccinated, get tested regularly, wear a face covering if you're out and about, try and spend lots of time in the fresh air, and then we'll all be able to enjoy this winter period and the build up to Christmas.
Thank you, Lucy.
Thanks.
Thank you, Lucy. And finally, I'll hand over to Jonathan Gribbin to give us an update on what's happening in Nottinghamshire County.
Thank you, Steve, and good morning, everyone. Thank you for joining us once again. So the present reality that I want to describe for Nottinghamshire is one in which we still see dozens and dozens of people needing to be admitted to our local hospitals for treatment that relates to COVID. So I think you can see straight away that COVID-19 remains a really serious health hazard for people in Nottinghamshire. Alongside that, we know that is very much driven by still hundreds of people across Nottinghamshire testing positive each day for coronavirus. So COVID-19 has certainly not gone away. And we really still remain very much in the heat of the pandemic. And in many ways, it's our local NHS and our care system who find themselves very much at the heart of that furnace of heat at the moment, and experiencing a very high degree of strain and pressure. And of course, that follows on from 18 months of strain and pressure. Now, that's important not only to the staff and services whom we've been clapping for in times past, and whose help and ongoing work we're so grateful for. It matters for local people as well, because these are services on which all of us depend, very often in moments of really critical need. So I'm really grateful to people across Nottinghamshire who've made it their business to stop the spread, and as a result bring us to this morning where I'm able to report what is at least a modest reduction in the rates in Nottinghamshire County, which today stands at 312 per 100,000 across the county, with some variation as ever across our districts and boroughs. And that amounts to between 300 and 400 people each day testing positive. But with winter ahead, I think we need to keep a slightly broader view of things, rather than simply whether the rates have gone down a little bit this week or up a little bit. They remain at a very high level, and this is contributing to the pressures that are felt in our local health and care system. So it's absolutely vital that we all continue to do whatever we can to protect ourselves and also to be protecting our local NHS. So I'd like just to underline once again that first and second doses are available still to people who've not yet taken up the offer of that. And I particularly want to thank the hundreds of people across Nottinghamshire who've come forward over the last week or so for their first dose, recognising how safe the vaccines have proven to be and how effective they are at protecting ourselves and also those around us as well. I'd like to underline once again the importance of testing, of those rapid lateral flow tests if you don't have symptoms, and you can get those free of charge and use them twice weekly. If you do have symptoms, anything in the way of a new continuous cough, a raised temperature, or a change in taste or smell, and even the mildest of symptoms, and even if you have been vaccinated, it remains essential that you isolate and also get a test and remain a PCR test and remain in isolation until you have the results. Wear a face covering when you're in enclosed, crowded spaces. And can I thank people again who've made it their business to do that on transport and in settings where they're mixing with people who they don't usually meet. And please continue to make sure that you're letting in plenty of fresh air when you're meeting indoors. And for as long as you can, do meet up out of doors whenever you can, because that's really the safest possible thing to do. So I'm really pleased to have seen a modest reduction in rates in Nottinghamshire County. But as I look ahead over the coming months and as we move into the deepest parts of winter, it's going to be important that every one of us does everything that we possibly can to protect ourselves and those around us. And in doing that, we'll find that we're protecting ourselves not only from coronavirus, but also from other respiratory infections like flu. And that will also help ease the situation in the local NHS and care system. Thank you.
Thank you, Jonathan. I'll throw it open to questions from the media now. The first hand up was Matt Jarrah. Matt, if you just let us know where you're from, that would be helpful. Thank you.
Hi all, good morning. From the BBC Local Democracy Reporting Service. First question to Amanda, please. In terms of hospitals, how many people now are critically ill, and what's the death rate like across Nottinghamshire? I don't think you mentioned that in your report. And also as well, is it still people who haven't been vaccinated, or are you noticing that people who are becoming ill have had their vaccines? So just give me a sense of that, please. And then to both Lucy and Jonathan, you know, walking around the city myself, you know, I wear my mask when I'm going to supermarkets, but and on public transport. But the difficulty is obviously all venues are now open in the city, nightclubs, bars, gigs like the Rescue Rooms and Rock City. How are we, you know, the message seems to be a bit mixed, because while, you know, people, you're saying, you know, wear your masks, social distance, you know, the nighttime economy is not doing that. It's actually sending another message across saying you're allowed to mix with people. So how are we going to ensure that this transmission doesn't happen as more people go out and celebrate Christmas, when, you know, they not necessarily do have to wear masks or social distance when they're in these type of venues? So I'm just trying to sort of figure out, you know, what we can do in that respect. And is it going to be a case of COVID will be with us for a long time while these venues are allowed to have people mixing so frequently? Sorry, a bit of a long-winded question, Matt.
No,
there you go.
No, that's fine. Thanks, Matt. So 2 questions there. So we'll pick up the first one first. So that was to Amanda about the number of people critically ill and the death rate, and what proportion of those are unvaccinated.
Yes, thank you. So so in those figures, so we had 20 people requiring intensive care as a result of coronavirus. So that's the most critically ill. So that's about 10% of the people who are in hospital do require the highest level of care. and are critically ill, in fact. In the week up to the 9th of November, there were 12 deaths and 18 deaths in the previous week of people who had been diagnosed with coronavirus in the 28 days before they died. So we are still unfortunately seeing, you know, it's not as high as it was in the peak. And thankfully, we do have the vaccine programme to you know, that's helped with that very much. But we are still seeing people dying of coronavirus. So it is, as Jonathan said, it is still very much with us. Yeah. In terms of the impact of the vaccines on hospital, again, really good question. We are definitely seeing that the vaccine has a significant protective effect against serious illness and death and hospitalisation. So when we look in the hospitals, the most seriously ill are still predominantly in our unvaccinated people, and still in that younger age range actually than we saw in the earlier waves, largely because older people are generally the people with the highest vaccination rates across our communities. So we are seeing younger people seriously ill who are unvaccinated, and we are seeing much higher levels of unvaccinated people who are seriously ill. So that remains the case. Thank you.
And so when you say younger people, what age range is that?
I think the main one is our sort of 40 to 70-year-olds we're seeing, whereas before it was in the very elderly population. That's the biggest proportion of people in hospital at the current time.
Thank you, Amanda. Matt, the second part of your question was about mixed messaging in terms of the fact that we still have a focus on masks, but you're suggesting that maybe that's not the focus of the nighttime economy. And how will we fare going towards Christmas? Jonathan, Lucy, would you like to have a go at that one?
I'm happy to start off on that one. And Matt, thank you for the question. I think probably the thing to underline is that the public health advice from the government, and certainly from the Director of Public Health in Nottinghamshire County, remains the same. It is the same as it was back in the summertime as we came into step 4 of the roadmap, and that is that we all need to act carefully and remain cautious. The advice more specifically about face coverings remains the same too, that we should be using a face covering in enclosed crowded spaces. And I'm really grateful to people across Nottinghamshire who've made it their business to do exactly that. And thank you to people who out and about on public transport, shops and elsewhere are using face coverings. I think the other things I just want to mention is that transmission can occur in all sorts of settings, not only when we're out and about, but when we're in our households as well. So the advice really does apply to all of us in a whole range of settings. And then the final thing I'd say is just to acknowledge that from time to time, I think each of us, myself included, just need to check and review and sometimes adjust to make sure that we are following that advice in full. And now with winter coming on is a great time. It's a very relevant and appropriate prompt for us all just to review whether we are doing what we can. So once again, I want to thank people who've reviewed their position and what they want to do about the vaccine, and thank you to the hundreds of people across Nottinghamshire still coming forward for first and second doses of the vaccine. For other people, the adjustments they might want to make will be different. It might be about their use of face coverings and just reviewing again, actually, some of these settings that I'm finding myself in, they are crowded and enclosed, and a face covering will be a really good thing to do to make sure that I'm protecting those around me. Thank you.
Thank you, Jonathan. Lucy, did you want to add anything?
No, I think Jonathan has put it brilliantly. I'll leave it there.
Lovely, thank you. Matt, thanks for the questions. The next hand up is Hugh Caswell.
Morning, everyone. Yeah, Hugh Castle from BBC Radio Nottingham here. Amanda, you've spoken a bit already about the increasing hospital pressure. I see that weekly hospital admissions have hit triple figures for the first time since about August, I think. There's been obviously a lot in the news in the last day or two about general pressure on the NHS, people waiting a long time for ambulances, for example. So could you talk to us a bit about the knock-on effect that having those higher numbers of COVID patients and what that has on the local healthcare system as a whole?
Yes, of course. And as you say, we are seeing very concerning numbers of people being admitted to hospitals, and the pressures on the ambulance services and other services as well, community, social care, primary care, all of those services are under considerable strain. It is the combination of having those people in hospital with coronavirus, those people outside of hospital with coronavirus who need healthcare and advice, and also people coming forward with problems that they may have had during coronavirus but thought didn't want to trouble people or come forward at that time. We are now seeing more people coming forward with some health problems that have probably built up over the pandemic and are now in perhaps a more advanced state and needing more medical care. And in addition to that, we are seeing some of the winter respiratory viruses, particularly in children as well. So we are seeing more children coming forward needing emergency care in the hospitals. So there's a combination of all of those things that all add up to considerable pressure. As Jonathan said, also people have been working for 18 months or so under additional strain, and some people are having to be off, to care for family members as well who have got coronavirus or may indeed be isolating themselves. So it's a combination of that increased demand, the COVID demand continuing, staff pressures as well, and people, whereas at the beginning people were able to work a lot of extra hours, now that is not a sustainable thing over a very long period of time. And we expect coronavirus to be with us for some months yet, and we are just going into the busiest winter period for the NHS. So it's quite a combination of different factors. Thank you.
Thanks, Amanda.
Thank you.
Hugh, did you have a follow-up question?
Please, yeah. For Lucy and for Jonathan, the deadline for care home staff to have both jabs passed yesterday. Of course, I'm looking at the figures released yesterday for older adult care home staff who've had both jabs. 85% for Nottingham, just over 90% for Nottinghamshire. So that's still a lot of staff who've not been fully vaccinated who now can't work in homes. So can you tell us what happens to those members of staff, and can you talk a bit about the extra strain on the care system locally as a result of staff not getting vaccinated?
Thanks, Hugh. Who would like to go first?
I can kick off with that one.
Thanks.
And Hugh, thank you for the question. Yes, we were anticipating that something in the order of 95% of staff working in care homes in Nottinghamshire would be vaccinated, and I think that's in line with what you've just reflected back. And I'm very grateful to those staff who've come forward for vaccines, and in doing that, they're helping just once again to do everything that they possibly can to protect those around them and those that they're working with, and I'm very grateful to them for that. We continue to encourage other staff in care homes to take up the offer, and we're also working with our providers to make sure that that they've got really robust contingency plans in place. What I should underline, Hugh, you're probably aware, but of course, these care homes are independent providers. They're not, these don't represent, for the most part, staff of Nottinghamshire County Council. So we're talking about providing support to independent providing organisations in the local system. And we're also undertaking some work with the sector, I think looking to develop a recruitment campaign over the winter period, and also some support that we may be able to provide them around that as well. So those are some of the things that we've got in place in Nottinghamshire County, at least. Thank you.
Thank you, Jonathan. Lucy, did you want to pick that up for the city?
Yeah, and really just to reiterate, I think, you know, we thank all of our care workers, whether they're in care homes or providing care in people's own homes, for the tremendous work that they've done over these really challenging last sort of 20 months or so, and they have really protected and cared for the most vulnerable at the most difficult time, and we're incredibly grateful for the work. And that's why we have worked so closely in order to be able to support people in making the decision around whether or not to get vaccinated. The position in Nottingham is that that we have higher than population uptake amongst our care home staff, and that those other staff that have chosen not to be vaccinated will be supported in finding other opportunities if they choose to, and that, you know, obviously as we come into the winter period, this is an incredibly busy time for both the NHS and for adult social care, and so we're working very closely with those care homes who have assured us that they can cover the care, that there is no risk currently, but obviously we want to continue, as Jonathan has outlined, in supporting them in recruiting staff and making sure that information is provided for people to make choices around getting vaccinated, and being able to provide care for those vulnerable people.
Thank you, Lucy. Hugh, thank you for the questions. The next hand is Alex Hulse.
Hi guys, it's Alex Hulse here from Capital and Global Radio. It was just one, it might be one for Amanda around booking booster jabs. I know we've certainly been made aware of some people who are registered as carers. Perhaps they're probably not working as a carer, but registered as carers for family members, perhaps, and they've been struggling to get their booster jabs booked. You know, I know the rules changed obviously this week so that people could book them early after 5 months, and we've certainly been made aware of people who are trying to book it via the website and then also ringing 119, and both are saying actually it might just be better off if you turn up after 6 months to a walk-in centre rather than trying to book, because the system isn't working. Is that something you're aware of, or is there any advice you can give to people?
Yeah, we continue to try and make the booking system as easy as possible, and the other potential route is through the GPs as well. But we are continuing to do that, and suggest if people do have queries to ring through to the inquiry line that we've got around the booking, but we will continue to try and make that as easy as possible for people to book ahead of time and make sure that the systems can respond to that. So we are continually adapting that to make that as easy as possible.
Thank you. Thanks, Alex. Alex, did you have a follow-up question?
No, that's fine for me. Thank you.
Wonderful, thank you. I can't see any more hands. I'll just pause for just a moment, just in case there's anybody else from the media who's here who would like to ask a question. Okay, in that case, we'll wrap up. Just say thank you to Lucy, Jonathan and Amanda. As always, thank you for your time, for being here today. And thank you to the media for helping us to keep the public informed about COVID-19. I wish everybody a happy Friday and have a good weekend.
Thank you all. Much appreciated.
Cheers.
Thanks, guys.